have the summer that we all want to see. I'm excited about the vaccination program and the success we've had. Dr. Henry is going to lay out some very important information that will highlight for all of us the importance of registering, getting a booking, and getting a vaccination. British Columbians from age 12 and up are accessible to this system. We have clinics in communities around British Columbia. It's easy, it's simple, and it'll keep you and your family and your community safe. So with that, I'll ask Dr. Henry to take the microphone, and I look forward to the briefing.
Thank you very much, and good afternoon. We'll start off with an update on our cases here in British Columbia today. Today we have 357 new cases diagnosed with COVID-19, bringing the total number of people with COVID-19 to 140,953 in British Columbia. 80 of the new cases live in the Vancouver Coastal Health Region, 210 in the Fraser Health Region, 12 are people in the Vancouver Island Health Region, 33 people live in Interior Health, and 22 in the Northern Health Region. We currently have 4,636 active cases across the province, 331 of whom are in hospital, 113 in critical care or ICU, and 134,521 people have recovered from their acute illness. Sadly, we continue to have people who die from COVID-19, and today we have 3 more of our family members, our friends, our colleagues who have passed away from COVID-19. One in Northern Health, and a person in their 70s, a person again in a long-term care home in Interior Health in their 90s, and 2 people in Fraser Health in their 60s and 80s. And our condolences go out to the family members, the care providers, and our communities who mourn all of the 1,661 people we have lost this year. We have 1 new outbreak to report, the Chartwell Carleton Care Home in Fraser Health, and outbreaks are now over at the Dawson Creek and Region Hospital and at Orchard Haven Long-Term Care. So this leaves us with 4 active outbreaks in long-term care and assisted living and 1 in acute care. It has reporting of outbreaks in assisted living and long-term care homes has been included in our daily reports from the very beginning of this pandemic, and the information is now summarized, as you know, in public health reports that come out weekly. The information is provided by the leaders in each of our health authority to the BC CDC, and that forms our weekly outbreak report. It has come to my attention in the past week that there are several outbreaks in assisted living that were responded to over the past number of months and were managed and aggressively, as we do for all outbreaks, but have not been reported or posted in our outbreak reports. 2 are in the Vancouver Coastal Health Region, 1 at the Terraces on 7th and 1 at the Chalmers Long-Term Care Home. Full action was taken by local public health and by my public health colleagues to manage with those facilities, but they have not yet been included. And so recently, as we became aware of this, we want to make sure that all of these outbreaks are in our outbreak reports, and they will be added today for transparency. And going forward, we will make sure that we include all of these outbreaks in our reports and the weekly outbreak reports. So the exciting news today that we continue to have growth in our immunization program, and we've delivered 2,687,360 doses of all 3 of our COVID-19 vaccines in BC. And that's a little over 58% of adults 18 and over in British Columbia, and about 3% or 138,906 have been second doses. I'd like to share a little bit of information about what that means for us. And this is an infographic that shows what we call vaccine effectiveness. And this is aligned with what we shared last Thursday when we talked about breakthrough and the risk of infection going down when people are immunized. What this looks at is those people in our community who are 70 years of age and over, who received a single dose of Pfizer vaccine mostly. How effective does that mean at a community level of preventing transmission of infections? And this is done using a very rigorous process led by Dr. Danuta Skrovansky at the BC CDC, where we have done this for many other respiratory pathogens, including influenza. And we're now at the point where we can assess the effect that our immunization program is having in our community here in BC. And what it shows us is that our vaccine program is highly effective. After 3 to 4 weeks, so 21 to 28 days, with a single dose, our risk in our community of transmitting SARS-CoV has been reduced by 70%. This means we prevent over 2 of 3 infections, new infections. This tells us really important things, along with the information we presented last week, that when we have this level of protection at a community level, our rates of transmission go down, our rates of severe illness go down, and that protects our hospital system and protects each one of us. It tells us our vaccines work, but it also reminds us that it takes time for these vaccines to do what they need to do to stimulate our immune system and for that full protection to come. And that means we need to continue to pay attention to our full safety measures for the coming weeks as we bridge to that new future that we have in the summer. As more and more of us are being immunized, this level of protection will spread in our communities. And importantly, today, everyone in BC, as the Premier has said, who is 12 and older, can now register and book your vaccine. Appointments are being booked for about 310,000 youth aged 12 to 17, and all of them are eligible for the Pfizer vaccine. Currently, it is only the Pfizer vaccine that's licensed for use in children, or has a notice of compliance, as we call it, for youth down to age 12. We are expecting that the Moderna vaccine, they have been doing trials in younger people around with that vaccine, and we're hopeful that it will, very soon, also be approved for use. But currently, it's the Pfizer vaccine, and young people will be welcomed into all of the clinics that we have around the province, whether it's our large immunization sites in some cases, in some more rural or remote communities. It might be the clinic set up for your whole of community immunization. In some cases, it will be in schools, but we have consulted with public health, with our youth groups and families, and we found that the most effective way for youth to be immunized and for families to go together is to do it through our clinics that we have established around the province. We will, like those 18 plus, we do encourage all youth to register online by phone at our Services BC Centre. And if you don't have a personal health number, then register by phone. You can book an appointment yourself if you're a young person in this category, or you can have a parent, guardian, or trusted adult work with you to do that. If a parent or guardian has an appointment booked already, you can bring the youth 12 to 17 with you to that appointment. And that's one thing that we're going to do at all of our clinics, so that families can come together and get vaccinated at the same time. If you plan to do this, it helps if you register, but that's not required. Or you can, but when you do arrive at the clinic, let people know so that we can have a special stream to make sure that we're able to get you through efficiently. We've been working with the Youth Vaccination Advisory Committee from the BC Children's Hospital to make sure that we have youth-friendly clinics available, and we can answer the questions that young people have about these vaccines and about their concerns. But please come together. We'll be having after-school clinics. There'll be clinics through this weekend that people will be eligible for. When you go to your appointments, please bring your ID for everyone getting vaccinated, and that could be a BC Services card, your school identification card, birth certificate, or a bank card, and ideally have your personal health number with you or available. It's an exciting step for all of us, and we know that youth are excited not only because it's important to protect themselves, but because they know that it's important to protect their families and their loved ones. And really, I hear from youth is to get their lives back so that we can get to that new future where we're able to socialize again and spend time together with those that we love. Just like we have seen countless people celebrating their vaccine with photos to friends and family on social media, we look forward to seeing young adults joining our team of millions of people now in British Columbia who are doing their part. And I know there's a number of young people in my life who are booked already, and I'm looking forward to seeing their pictures soon. We know that many young people have been negatively impacted by COVID-19 and by the pandemic and by the measures that we've had to put in place now. Now you too will have the opportunity to get vaccinated, to get protected, and to protect those around you. I know it has been tough, but there is a light ahead and it's coming soon. I'd like to remind everybody, though, that our public health and travel restrictions are still in place until end of this long weekend. And the vaccine effectiveness, the information we've presented on how we are managing and the pandemic and the situation we're in right now reinforces we need to stay the course. Now is not the time to let up, as we're doing so well and getting so far ahead. This means we all need to stay local, stay small, and continue to use all of our layers of protection. I want to ensure all of the positive momentum that we have gained in these last weeks through the sacrifices, small and great, that all of us have made are going to get us safely to this next part of our pandemic journey. Getting vaccinated is how we'll be able to put the COVID-19 pandemic behind us and make sure that even though this virus is going to be with us for some time, we can manage that without putting the strain on our families and our communities that we have now. We're making incredible progress by registering, booking, getting immunized, staying small, and staying local. We are all one step closer to the end of this pandemic. I wish everybody a happy and safe long weekend and remind you that no matter where you may be or what you may be doing, now is our time to continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Premier. Thank you very much, Dr. Henry. I wanted to start by passing on my condolences, those of the Premier, the government, everyone in BC, to the families, friends, and caregivers of the 3 people who passed away in the last 24 hours linked to COVID-19 in BC. It continues to be, this long into the pandemic, a difficult time for many people, an impossible time to come together and grieve in the way that they need to. And so we want to let those families know, those friends, communities, caregivers know that we grieve with them today, and we are thinking about them every day. I wanted to just note that we've seen, as you know, with respect to hospitalizations, some decline in the level of hospitalizations from a high of 511 in hospital and 183 in critical care to 331 in hospital today and 113 in critical care. And while that situation is an obvious improvement, we continue to face challenges. For example, we are still using surge beds in our healthcare system. We have a lot of available base and surge beds across the system, 3,035 overall in hospitals and 298 vacant base and surge beds overall. But we're still using 13 in critical care, 13 surge beds in critical care, and 167 throughout our hospital system. And this tells us there continues to be real pressure in our hospital system and something to reflect on every day. And we want to thank everyone working in healthcare, from healthcare assistants to healthcare workers to health science professionals, nurses, doctors, pharmacists, everyone who's involved in immunization, but particularly in acute care in this challenging time, for their continued work in this area. I want to let all of you know, because there's a lot of interest in this, that the BC CDC's interactive dashboard with vaccination coverage, test positivity, and case rates for CHSA, that's Community Health Service Area, and LHA, Local Health Area Level Data, is now ready to launch this afternoon, and it will be launching and live on the BC CDC website before 4:30 today. Every Thursday, we bring you up to date on the surgical renewal commitment. As you know, Tuesday, May 18th, a year ago, we resumed surgeries after the first wave of COVID-19. We've had many achievements since then, and these are outlined in our weekly and monthly surgical renewal progress reports. And as noted, right now we are beginning to see hospitalizations decrease, but our hospitalization rate remains significantly higher than it was in the first wave of the pandemic. To May 16th, a total of 1,843 surgeries have been postponed. Just as we bring you up to date, we should note that we have completed very significant surgeries. For example, in the week of May 3rd to 9th, health authorities completed 7,015 surgeries, of which 5,569 were scheduled and 1,445 were unscheduled surgeries. And that is a significant achievement in a pandemic. To have done that, 7,000 surgeries is not far from what we do normally. It reflects the changes we've made, but it also reflects the extraordinary work we've done in our system. But these changes and these limits on the number of surgeries we do continue, and it should send a message given how strongly I feel, and doctors and nurses and health sciences professionals and health authorities and the premiers and Dr. Henry feel about the need to continue to work together to bring down transmission in BC this weekend, that we are not making changes as of today in what we're doing in acute care. It's an important message to everyone that we need to stay the course, especially during this long weekend. I want to say just finally that we continue to register a very significant number of people. As you know, about 59% of all eligible adults now have been immunized, 54.9% of all eligible people, which is now 12 and above, have been immunized, and 2,765,082 people have registered. You recall when the Premier launched our efforts to boost registrations a couple of weeks ago, that number was 2 million. So we've seen a significant increase. My message this weekend is register, 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 and then book, book, book. Whether you're 14 or 44 or 84, if you haven't registered, registered. If you haven't booked, book. And if we do that, we can continue to make progress in the COVID-19 pandemic. I wanted to say finally en français qu'aujourd'hui nous annonçons 357 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 140 953 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 pour un total de 1,661 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 331 personnes sont actuellement hospitalisées, dont 113 en soins intensifs. Merci beaucoup. Thank you very much. I'm going to return the podium to the Premier, and we're happy to take your questions.
Thank you, Adrian and Dr. Henry. And again, reinforcing, register, get a booking, get a vaccination. Health orders are in place, travel restrictions are in place until the end of the long weekend, not the beginning, not Saturday, not Sunday, not Monday, but the end of the long weekend. And with that, all three of us are here to answer any questions you may have.
Thank you. As a reminder to everybody on the phone line, please press *1 to enter the queue. You will be limited to one question and one follow-up only. First question today is from Richard Zussman, Global News.
This is for Premier Horgan. How worried are you about people traveling over the weekend? We know that there are campgrounds that are very busy. We know there are people who are planning on traveling to summer homes this weekend. Is there a fear, and are you confident enough is being done to crack down on those who may travel over the weekend?
Well, we've been clear for weeks and weeks now that whenever we've had a long weekend, whether it was Easter, whether it was earlier in February and in January, whenever there's been a long weekend, we've seen an increase in case counts, which leads to an increase in potential fatalities, an increase in hospitalization, which could lead to acute care, or intensive care units being overrun. So I want British Columbians to understand that I appreciate it's going to be a gorgeous weekend, certainly on the part of BC that I have the good fortune of living in, and I suspect in many, many other parts of the province. So stay local, stay close to home. If you have a cottage within your health authority, that of course is absolutely okay by me. but we need to follow the rules until we come out of this circuit breaker. And on Tuesday, Minister Dix, Dr. Henry, and I will be laying out the plan forward. It's a positive plan. People will be excited about it, but let's get through this weekend. It's so critically important. We can't stress enough how important it is to follow the guidelines. Don't look for loopholes. Don't look for ways around it. Find another way to enjoy the weekend and look forward to a fantastic summer.
Richard, do you have a follow-up?
I do. I have one for Dr. Henry and one for Minister Dix. For Dr. Henry, if someone has a family member, if they're booked for a vaccine and their family member is 12 to 17, can they all go get their shot together, potentially over the next few weeks? Like, is that something that's being looked at? And Minister Dix, a study is being done in conjunction with the BC CDC around vaccination levels at long-term care homes, comparing staff to residents. It's obviously much lower for staff. Are you concerned about that, and why do you believe that has happened?
So in terms of the first question, yes, we're trying to make all of our immunization clinics. This is one of the operational things that we've been consulting on over the last couple of weeks since the Pfizer vaccine, or last 10 days or so, since the Pfizer vaccine was approved for use in younger children. And yes, you can, if you have a parent or a guardian who has an appointment booked for tomorrow and you're 12 to 17, you can go with them. And we will make the clinics family friendly for everybody. That's the intent right now, that families can go together, and that's one of the reasons why we're doing most of the immunization through the clinics, the community clinics that we have established. So yes, go together.
I think the overall take-up in long-term care of vaccination has been excellent. We're monitoring these things all the time. Remember, there are new people coming in and working, and obviously new residents in long-term care, so it's important to keep the situation updated. In addition, it's important to remember, I think, that we're going through, in most long-term care homes that haven't finished, didn't finish their second doses. So if you remember from the month of March, about 72% of residents, and I think about the same number of staff in long-term care had received their second dose. But we're going through a period where we're ensuring second doses in all those places, and that has been an opportunity throughout the province to reinforce the importance of vaccination and first doses. And that will be true everywhere. Remember, we'll be doing second doses as we go forward through the summer, and that will be our opportunity to pick up people who may have missed their first doses. So I think there's been very significant take-up around healthcare workers, whether they're in acute care and long-term care. We can always do better because we're always short of 100%. But this is a period when we're continuing to push and raise those immunization efforts everywhere. Just to give you one final example, 87% of people over 70 have now received their vaccination, 87%, 83% of people over 60. But as people will note, that leaves some people in those categories who are eligible to be vaccinated, no reason not to be vaccinated, who need to be vaccinated. So we're going to continue to push in all these categories, and I think you're right, Richard. We have to continue to do that in healthcare and everywhere else as we can raise the level of vaccination to the absolute highest possible level. It's more important than long-term care in most places, but you'll see in terms of our results in long-term care that were presented in detail by Dr. Henry in the last number of modeling sessions that she's presented, the impact of vaccination on long-term care, on staff and on residents has been profound, continues to be profound, and demonstrates why everybody should register, book.
Next question is from Binder Sajjan, CTV.
Hello. I'm just wondering, do young people who have registered, do they need to wait for a text inviting them to book, or can they just call to book now? And can you also clarify if kids need parents' permission to get vaccinated?
Sure. So if people are registered, they will get an invitation to book when the clinics are available in their area. So those invitations go out on a periodic basis. So yes, they should get a text. But if they haven't got a text, you can call, you can check on where the times are. And yes, we have what's called mature minor consent here in British Columbia, and that's part of the Infants Act. And there's no limit to the age that somebody can consent for medical treatment, including immunization. And that's something that we've worked a lot with youth on across the province over the years. And we public health nurses in particular and public health physicians are very good at assessing and talking to youth. So we'll make sure that resources are available in all of the clinics to assess if a young person comes in by themselves, to make sure that they understand the implications and can consent for receiving vaccination. So you don't need to have a parent's consent. You don't need to have a signed consent form. We can do the understanding of the implications of the vaccine and provide people with young people with a vaccine themselves.
Follow-up, Binder?
Yes, I just wanted to also ask about, just following up on what Richard asked there in terms of enforcement. Will there be, I'm just unclear if we can expect more enforcement this weekend. And also when it comes to the reopening plan that's going to be unveiled on Tuesday, I'm wondering what level of detail will people see? We see in other jurisdictions they talk about level of vaccination and cases. What can people expect on Tuesday?
Well, they can expect on Tuesday that the circuit breaker will be over and a roadmap will be laid out for all British Columbians to see. This is great news for young people who, as Bonnie has said, want to get on with their lives. It's great news for entrepreneurs. It's great news for workers. It's great news for adults who want to get on with their lives. And this is what we've been working towards for the past number of weeks, and there'll be an abundant amount of information on Tuesday. We look forward to talking to you about that then. With respect to enforcement of the travel restrictions and the other health orders that Dr. Henry's put in place, that will be as it has been on other days and other weekends. But again, it's critically important that people remember that because the weather is good and the trajectory on case counts is positive, we are not done yet. And I really encourage people to please, please, please follow the rules. Don't look for loopholes. Don't try and get around things. Enjoy a good weekend. And then, of course, next week we'll be plotting our way forward together.
Justine Hunter, Globe and Mail.
First one's to you. Ontario announced their restart program today for details for things that will happen in mid-June. I'm just wondering why you feel British Columbians shouldn't be given that detail now. Are you concerned that they will not hear the details around the fact that they have to wait? Or I'm just trying to get a sense of what the motivation is for holding off until Tuesday.
Well, the motivation is just as you suggested, Justine. It's human nature, and we've seen it in previous situations through the pandemic, that when people hear that there's good news on the horizon, they assume that horizon is now. And we need to get through this long weekend. It was thoughtfully put in place. Dr. Henry and her team and the government worked to make sure we put in place a program that was not overly onerous, but would meet the test of reducing transmission, keeping people safe, and keeping as much of our economy open as possible. That's been our course from the beginning. Dr. Henry's approach was not to shut things down, but to find ways that we could operate safely. And for the past 15 months, we've had outstanding results. Mr. Ford and other premiers across the country have had different circumstances. The virus has affected different provinces in different ways. We're confident that the plan that we'll lay out on Tuesday will be a positive one for all British Columbians, whether they're people of faith who are yearning to get back to their temples, to their churches, to their gurdwaras, people who want to get back onto the field and play a game, people who want to travel to their home or their summer homes in other parts of the province. All of that is just around the corner, but it has to be a slow and methodical approach. We're confident that come July, we're going to be in a much better place. But on Tuesday, we'll lay out that roadmap, and I think it'll be positively received by the vast majority of British Columbians, and I'm confident that they can wait a few more days.
Justine, do you have a follow-up?
I do, and this one's for Dr. Henry, please. Ontario is talking again today about some potential delays in vaccine supply. They're saying they're going to get 40 million doses instead of 48 million by the end of June. I'm just wondering, with adding 310,000 people to the first dose list, if you could just walk us through a bit of what this means for people who are waiting for their second dose.
Yeah, so we have been obviously looking at the buckets of vaccine that we have been guaranteed to receive and where they fit, and the population that we're including at different levels, and that is one of the reasons why we have taken the approach that we have of not introducing the 12 to 17 10 days ago, because we were titrating down the age groups, as you know. And we've built in the second dose trajectories as well. And I can say, and I've said this before, we've already moved up to about 13 weeks for everybody, most people, except for the people who received it very early on. But we're now at the point where we have a lot of vaccine coming in the next 6 weeks. So we are moving people up, and we will be looking at moving up, particularly the people that we prioritized in the first wave of this as vaccine came in. So those who are older, who have not yet received their second dose, can expect to be being notified very soon. I will say, and I know this is a challenging thing for many people, and I get a lot of questions about this. Early on, we didn't have a provincial registration system, but we do have a provincial immunization repository or registry. So everybody's dose is in there, in our provincial immunization registry, but we may not have your contact information. So if you were somebody who was immunized before the middle of April, before April 15th, go on the Get Vaccinated and register again. Even if it's more than once, it's fine. That is one way of making sure that you will get your invitation for your second dose as quickly as possible. If you have any concerns, you can call the number as well, and phone in and to get that sorted out for you. So which is all to say, yes, we expect to be moving everybody up in the order that they were prioritized, which means that people who were on our clinically extremely vulnerable list can expect to receive an invitation. When we had limited vaccine, we spread those groups of people out over a number of weeks. Everybody will be eligible within a much shorter period of time in the coming weeks, and we expect that to happen within the next 2 weeks. So this will not delay the moving up of second doses for people who are most at risk, which are elderly in our communities who have not yet received their second dose, for people who are clinically extremely vulnerable.
Camille Baines, Canadian Press.
Hi there, Dr. Henry, could you please explain the rationale behind not doing the vaccinations in schools where other types of vaccinations are already being done?
Yeah, there's a couple of reasons for that. We did consult with a number of different stakeholder groups, including our education partners, and we are working with them to make sure information gets out to families. But there's two main reasons. One, we heard that families want to go together, and kids at different ages want to be able to, that they want their children of different ages to be able to go together, and that often means that people are in different schools. And quite frankly, most of our public health staff is still very much engaged with the immunization clinics, as well as managing cases and contacts and outbreaks in our pandemic response. So it takes a lot of resources to go into every single school in a very short period of time, and that would not have been able to be done equitably across especially some of our larger health authorities, where our clinics are established and ready to ramp up to have families come, and we're taking those measures to make it easier for families to come together and get their immunization now that the whole age group is eligible. So that was the decision that we made based on the information that we got, our BC Immunization Committee, and the feedback that we got from families and youth. Having said that, in some communities it will be an all-of-community approach, and in some communities the school is the place where it's more convenient and easy to reach to reach youth. So, and First Nations communities, we've been talking with the First Nations Health Authority about our strategies for going back into First Nations communities for second doses and doing youth at that same time with their first dose. So all of those strategies are going to be used around the province, but we're not doing a solely school-based program for a number of reasons that I just outlined.
Camille, do you have a follow-up?
Yes, I do. Thank you. I'm wondering what kinds of strategies will be in place to remove some barriers, like parents needing to work. Will some of these clinics be open later at night?
Yeah, and we're looking at after school hours and how we can facilitate that as well. I know there's provisions, and maybe I can turn to Minister Dix for this, around parents being able to take time off work and scheduling and rescheduling of clinic hours, extending of clinic hours. And I will say immunization clinics are open this entire weekend around the province, and so that's an opportunity as well. Did you want to talk about that?
As you'll know, the legislature unanimously passed legislation by my colleague, presented by my colleague Labour Minister Harry Baines, to provide paid leave for immunization, and that possibility is there for people. But you'll also see, as people know from our vaccination clinics, that our clinics are 7 days a week right now. There'll be people immunized every day over this long weekend in very significant numbers. It's slightly less on the weekends than it is on weekdays, but we have a lot of clinic times into the evening on weekends. During this long weekend, for example, there are still some appointments, a small number of appointments available, but there will be through the week. So there are lots of opportunities to be immunized, and we're going to expand that and look at the needs and expand that out to the needs of this particular group of people from 12 to 17 over the next couple of weeks. So there is a provision for leave. There's lots of opportunity to be immunized, and we're hoping that everyone takes advantage of that. We've had weeks recently, last week, where I think we had 332,000 available appointments, which were essentially all used, which tells us that we are open for significant times, but we of course are looking to expand that as we increase our supply of vaccine starting in June, especially our supply of Pfizer vaccine in June, which will increase on a weekly basis, and some discussions of this, but in the initial period in June by something like 20%. Oh, the Moderna came? Oh, you come back.
I was just going to say that one of our concerns had been Moderna shipments, and but the shipments for next week actually arrived today and tomorrow, so we'll have lots of vaccine for the weekend as well.
Next question, Lisa Houston, News 1130.
Hi there. A question about AstraZeneca. I've talked to people in the interior, I think it's Kamloops in particular, who have received their second dose, and I know that there's a pharmacy over here on the island that was giving second doses because they're not allowed to give first anymore, but they had some that I'm understanding were ready to expire. So I'm wondering if you can talk about how many of these second doses are being given out, and does this mean that some of the rest of the people who have had their first doses who are now getting passing the 4-week mark might be able to get their second dose sooner?
Yeah, so it was a very, very small amount. There were some vials that were already open that had to be used up within a few hours to days. So yes, we said rather than starting somebody anew, use those up on people who had already passed at least 4 to 6 weeks so that they could get start with their second dose. So it's in the less than hundreds. And it was just to make sure that we weren't wasting any vaccine. And as we know, AstraZeneca is a vaccine that's very important globally, and we want to make sure we're using all of the amount that we have.
Follow up, Lisa?
Regarding not necessarily even hesitancy, but some of these youth or families that have either barriers to getting their doses, we've seen in other countries, they sort of hit a wall. All the people who are super jacked about getting their shots get out there quickly, and then it peters off, and they're doing different things to woo people. I've heard, in Israel, it was a shot for a shot. And in America, I've heard of different things there. And so I'm wondering what kind of plans are there to encourage, especially the younger demographics that tend not to, be the first ones to get out there because they're the least at risk.
Yeah, they are the least at risk, but at least in my discussions with youth and what we hear from young people is there's a lot of important incentives for them to get immunized. One, of course, is as young people, at least once in my life, have a very strong sense of social connection and wanting to make sure that their parents are protected or their grandparents are protected. But also it really is about missing out on life and wanting to get that back and recognizing that this is an important way for us as a community to be able to get back to those social connections that we need and those opportunities that we want and need. So we are hearing that loud and clear. Clearly, young people have questions, as do everybody. There's a lot of people who are not quite sure and looking at what are their friends doing, and I think it's really important that we encourage them to look this up, to go to credible sources of information, the BC CDC website, to ask questions, and we're providing information. There'll be much more available for parents, for adults, through our school system, so that we can answer those questions that young people may have about the vaccine. And I think that's really, really important. And then, as we say, removing those barriers. You can go in with a parent or guardian, you can go in after school with your friends. There'll be people who know how to ask you the right questions. You don't have to have your PHN, but you do need to just have some identification so they can help you get through the process. And that's where we're starting. Clearly, we need to we have not reached that plateau so far in British Columbia, and I think that's because we have provided as much information as we can. We're doing better at getting out in different languages, in different settings with people, and the partnerships that we have with leaders in communities, faith leaders, First Nations leaders, municipal and regional leaders, these things help. But for youth, I think it really is about them speaking to each other on this. And we've engaged with, as I mentioned, the Youth Advisory Committee at Children's Hospital around immunizations and what are the things that matter most to young people. So yes, we will be putting out more messages and support for young people.
Nick Johansson, Castanet.
This question's for Dr. Henry. One of the restrictions set to expire at the end of the long weekend is the indoor dining ban. Restaurants have been blindsided by some of the orders in the past. I'm thinking the New Year's Eve last call change and this current indoor dining ban. Earlier this week, the BC Restaurant and Food Services Association requested some notice about lifting the current order, citing unique concerns about perishable products and bringing back their employees. Are you able to give any indication to this industry about whether or not they'll be opening their dining rooms in 5 days' time?
Thanks. I'll take that question. The challenges of managing this in a fair way, so all of the people that have been affected by the circuit breaker get information at the same time, is to hold with the position that Dr. Henry, Minister Dix, and I had from the beginning, that the circuit breaker was going to be in effect until midnight on the Monday of the long weekend. Everyone knows that, everyone heard that, and they've also heard that on Tuesday, Minister Dix, Dr. Henry and I will be laying out the roadmap going forward. I appreciate there's a whole bunch of different ways to ask the question, but that's the answer. What we'd like to see over the weekend is people taking advantage of an opportunity to perhaps go to one of their favorite restaurants, get a takeout meal, stop in at the immunization center, get vaccinated, enjoy the good weather, and on Tuesday, the roadmap will be laid out for all British Columbians to see.
Do you have a follow-up, Nick?
Yeah, I guess just that there's obviously some unique circumstances for someone trying to run a business such as a restaurant. Obviously, you couldn't open your indoor dining on no notice, such as a Tuesday afternoon announcement. Is any indication going to be given, not publicly, but to any of these restaurant associations?
Well, again, the planning will begin when the orders are lifted, and the orders are lifted at midnight on Monday of the long weekend, and the roadmap will be laid out on the Tuesday. I think that's the fairest way that we can manage the many British Columbians, not just those in the hospitality sector, who have been outstanding, by the way. This has been a challenge for them more than, aside from the tourism industry, the hospitality sector has had the most challenge because we can't have people congregating, we can't have people coming together in large large numbers. We understand that. But the health, by and large, the hospitality sector also understands that we have to ensure that we give this information equitably to all British Columbians so they can make the choices that they need to make coming out of the circuit breaker and going into the restart plan, which will be abundantly clear come Tuesday.
Last question today comes from Tanya Fletcher, CBC.
Yeah, Dr. Bonnie Henry, given what the Premier has just said in confidently stating that the circuit breaker will be lifted come Tuesday, I mean, you had mentioned in the last briefing that we'd have to take a look and see how the numbers were doing right through until the long weekend. Are we just that confident that we're headed in the right direction that we can be so sure to make those statements now and not come Tuesday?
You know what, all of the things, you have the same information that we have. We are seeing things go in the right direction, but we also know that we have learned in the last 18 months that things can change quickly. And while we've talked about the future, nothing is going to be back to 100% on Tuesday. It's not going to be a light switch. It's going to be a dimmer switch. We know, and I presented this last week and again today with the vaccine effectiveness, it takes time. We know that more and more people in British Columbia are being immunized, and in 3 to 4 weeks, that protection will be maximal for a much greater proportion of our population. So those are the things that we need to think about now. We cannot waste all of the sacrifices that we have done in this last 6 weeks in this circuit breaker. Right now, we have put in a number of additional measures, and we need to follow things through this weekend, and we need to follow through into next week. And then we'll lay out the plan for what the future will hold. But it's not going to be everything at once. It's going to be slowly but surely moving towards the light.
Follow up, Tanya?
Yes, please. And for my colleagues, Minister Dix, if we could get answers in French as well for both. Thank you. Yes, as we've seen, case counts have been on a stronger downward trend recently. What do you attribute this to? I mean, these restrictions have largely remained the same since the end of March, except for the non-essential regional travel ban that was added along with the circuit breaker extension a few weeks ago. So what's changed that we're seeing the indicators go down now? You know, has weather been a factor, for example?
You know, we think weather has something to do with it, and we've talked about that a little bit, but really it takes time. As we know, the case today was exposed as long as 14 days ago. We know that what we're dealing with today is what happened 2 to 3 weeks ago. So it takes that amount of time. Once we put in additional measures, we saw that cases continued to go up for some time. And now it also, you know, we've seen incremental growth, we see incremental decay as well. Once you hit that certain point where people are taking the measures to stop transmission, so that we're not having as many people exposed for everybody who's infected, then we start to see things go down quite quickly. And that's what we've been seeing finally in this last few weeks. So it really is a combination of fewer people being, more people being protected through immunization, but people taking seriously these the measures that we have in place, not traveling as much, not exposing as many people. The workplace measures that we've heightened have meant that there's fewer transmissions in workplaces, fewer outbreaks in workplaces, fewer opportunities for things to transmit widely in indoor settings like gyms and sadly and unfortunately some restaurant and other indoor settings. So these are the things that have made a difference. They're not things that we can stop yet. As we get down and down in cases, it's going to become more and more challenging to reduce them even more. So it's just a matter of okay, now anyway, yes, the short answer is it's because the things that we're doing are stopping us from exposing greater numbers of people, and over time we see that decrease. And thankfully, we're seeing the decrease reflected in the people who end up in hospital and end up in ICU. And those take longer to go up and longer to come down. So we're not out of the woods completely yet. We still are not at the place, for example, when we can restart the surgeries that have been postponed. But that's where we need to get to. So we can't take advantage of the weather to let go of these important measures that we continue for this weekend. That was kind of, maybe you can summarize it better in French.
Well, en français, c'est bien ça. Just to say to everyone that tomorrow, Friday, there'll be an update at around 3 o'clock with a full update. On Monday, there'll be a more limited update just to bring everyone up to date on Monday of the long weekend about where we are with respect to case counts and vaccinations and so on. Je dirais en français que ce qu'on a vu depuis ces dernières 2 semaines surtout, c'est l'effort des gens de la Colombie-Britannique, premièrement, qui ont pris l'action de réduire la transmission de COVID-19. On a eu des mesures importantes, en effet, depuis le mois de novembre, n'est-ce pas, des mesures importantes qui continuent jusqu'à aujourd'hui et qui va continuer à être là pour le moins jusqu'à mardi prochain et sans doute plus longtemps. Donc, on a ces mesures-là, donc on a limité la transmission, mais il y a aussi, évidemment, l'effet de la vaccination. Maintenant, 59% des gens ont été vaccinés, un peu par des adultes, je veux dire, un peu partout en Colombie-Britannique, avec 54% des gens en plus de 12 ans qui ont été vaccinés, et cela a un effet important aussi. Et le message aujourd'hui, c'est que tout le monde doit aller recevoir leur vaccination. Cet effort de vacciner des gens vous protège tout le monde. Vacciner. Il faut le faire ce week-end et pendant le mois à venir. Cela donne un avantage réel à tout le monde et j'espère que tout le monde va avoir un bon week-end. À mardi, see you Tuesday.
Are you